doing counseling on your own or having a designated counselor, the pros and the cons?
Counselor in our practice plays secondary role, where their role is mainly to just re-emphasize whatever has been already told, and mainly in fixing up the logistics. So for us, pre-operative workup is a separate clinic altogether. So if somebody has come in the OPD and there's a grade 3 cataract, and the patient says, I want to get operated as soon as possible, which lens do you suggest for me? We stop it at that point of time. So we tell them that today was your preliminary examination. You have significant cataract, which we think requires surgery and it will benefit you. There are various lens options, but we need to do a detailed, thorough examination of all structures of your eye, including scans of the measurements and retinal scans before taking a final decision. So first thing, just because the patient is motivated, and we call them separately on the pre-operative clinic, and the consultant at that point of time is doing only pre-operative patients, nothing else. So there is no stress of 10 patients waiting outside the OPD. How do I finish him quickly? And when they come for the pre-operative clinic, we give them in writing as well, and we tell them that please bring the attendants who are going to help you make the decision. Because when you sometimes say bring some attendant with you, they can bring their neighbor, sometimes they can bring anyone along with them. So tell them that bring an attendant to who is going to help you make the decision along with you. And only after the doctor counseling is done does the counselor actually meet the patient. So for us, doctor first and counselor second.
So basically it depends. We have a very high volume practice, so it depends upon the which category the patients are coming. We do not have a separate day like pre-op days. So some patients are designated for like CGHS patient, West Bengal Health Service patient, and other patient. They are fixed category. So there we do not have to explain much. So you have a cataract and you take the date from the counselor. And another group of patients, those who are, you can play with them actually. What is that patient's like demand and how much the patient's ability to pay? Then we speak some. After, of course, all the examination is finished. We do routinely macular OCT in 100% of our cases. We do specular microscopy in all our cases. And depending upon the situation, we tell the patients about the premium IOLs and toric or other kind of IOLs. But we are not very keen on promoting premium IOL in the name of EDOF or trifocal lenses. Toric, we do prefer counsel each and every patient. Personally, we actually counsel them about the you need this kind of.
Right. So Dr. Karan, sir, yes, your point as a youngster.
Yeah, so basically, I'll just give you two scenarios. I was recently in a charitable setup who I've just left, which I have just left. So there, the counseling department was handling all because there was a big bulk of patients. However, whenever there was a patient which required a toric lens or a multifocal, if somebody asked, then I had specific instructions to the counselor that you bring the patient to me so that I can explain that in a much better format. For such cases, I also do that. Particularly for a toric, I would put a cylindrical. I would make them wear the frame, and then I would put a cylinder about 1.5, and this is on the attendant. The attendant will wear that, and then I would say this is how you're going to see. And there are also some cards that I've gotten made, which shows that this is the vision that you will have for just with cataract. This is how you will have with astigmatism. This is when you will if you implant a toric lens, this is how it will look. And similarly, I do a little bit for the near vision as well. However, coming to now practice, now I've entered a private setup. Now I am counseling the patients myself because particularly I don't have that many resources. It's a small clinic, so I do the basic counseling myself, and and they do ask the cost also. I tell them, but if the patient is getting too much, asking too many questions or something, and it sometimes it looks like they're in the window shopping mode, then I send it to my staff to talk. And when they have something concrete, then they come to me and talk.